Welcome to MH Health. In today's video, we talk about pregnancy of unknown location PUL. Your trust matters. The information in this video is based on reliable sources from the National Health Service, NHS. Our goal is to give you accurate and helpful health advice. Stay with us to learn important facts that can help you and your family make better health choices. During the ultrasound, no pregnancy was seen inside or outside of uterus, womb, despite a positive urine pregnancy test, and so condition has been given the label pregnancy of unknown location. What does it mean? A pregnancy of unknown location means one of three possibilities. 1. Very early intrauterine pregnancy. This means the pregnancy is in the correct place but too small to see on scan or 2. 2. Miscarriage. This means the pregnancy has ended and the developing tissue has already passed out of the body. 3. Ectopic pregnancy. This means the pregnancy is developing outside the uterus. Studies report that 5 to 42% of women attending for an ultrasound assessment in early pregnancy will be classified as having a PUL. However, reports from specialized early pregnancy units describe lower PUL rates of 8 to 10%. What will be the next step? At the moment, it is not sure which of the mentioned possibilities are applicable. Details of symptoms and past gynecological history can help to decide what is most likely. Risk of an ectopic pregnancy. Previous ectopic pregnancy, history of sexually transmitted infections, STI, or pelvic inflammatory disease, PID, previous pelvic and/or tubal surgery, including surgery for appendicitis, smoking appendicitis, presence of a contraceptive coil, IUCD, use of the progesterone-only pill, mini-pill, POP, in vitro fertilization, IVF, or ovulation induction. If any risk factors or symptoms are not present, blood samples are taken. These blood samples test the level of pregnancy hormone, beta-HCG. The beta-HCG level tells how much pregnancy hormone were present in the body. Symptoms to be aware of. Abdominal or pelvic, lower part of the abdomen located between your hip bones. Pain. Pain on the top of your shoulders, vomiting and/or diarrhea. Dizziness, fainting, pale face. Pain on passing stool, urine, backache, shivering, breast tenderness. Early intrauterine pregnancy, up to 25%. This is where the pregnancy is developing inside the uterus. However, it has not yet developed to a stage where we can see it on ultrasound scan. It is not possible to tell whether this pregnancy is viable. This is a very common situation, especially if you are unsure of the date of your last period and/or have irregular periods. Miscarriage, up to 65%. If you have had heavy bleeding in this pregnancy, it is quite likely you may have passed the pregnancy during this time. As everything has passed and nothing is seen in your uterus on scan, we term this a complete miscarriage. Ectopic pregnancy, up to 10%. Ectopic pregnancy is a common, potentially life-threatening condition affecting 1 in 100 pregnancies. It occurs when the fertilized egg implants outside the cavity of the uterus, usually in the fallopian tube, and as the pregnancy continues, it causes pain and/or bleeding. If it is not treated quickly enough, the fallopian tube can burst, causing internal bleeding. This can lead to shock and even death. If you do have an ectopic pregnancy, this will be treated either with medication or surgery, or sometimes close monitoring. Persistent PUL. A very small proportion of women with a PUL may be given the descriptive term of persisting PUL. In such cases, the beta-HCG level does not spontaneously decline but plateaus, whilst no intrauterine or ectopic pregnancy can be identified on follow-up scan. This is likely to be a small ectopic pregnancy that has not been visualized or some retained tissue in the uterus. This can be treated with either close monitoring or medication. Thanks for watching. Please like, share, and subscribe to our channel.